Now, to commemorate Hospice Week from the 4th to the 10th of May, we're shining a light on the extraordinary yet often unseen work of palliative care providers across South Africa, from the early days of the hospice movement to the present-day work of the Association of Palliative Care Centers, APCC. These organizations continue to serve insured and uninsured South Africans with compassion and resilience, often without formal funding. I'm joined by Tertia Berger, who is the Interim CEO of the APCC and CEO of Stepping Stone Hospice. Tertia, good morning and thank you for joining me.
Sam, thank you so much for having me.
What an amazing, compassionate bunch of people you are, and the kind of work that you do. I have been fortunate enough a couple of years ago, as part of the media, to go on a media tour of your hospice centers.
Oh, wow.
And I was fortunate. I think the lady's name was it Grace or Joe Rawudo? I can't remember her name now, but she was, back then she was involved in media and marketing, and she took us on this tour of the centers, and wow, was I blown away. I don't think ordinary South Africans ever walk into a hospice unless there's something immediate, their challenge faced with a family member.
Absolutely.
But if you have not been into a hospice center, if you've not met the people, this is arguably one of the most amazing organizations in this country.
I agree. And this makes our life so difficult because people don't want to hear about us or think about us until they are actually in that situation. And a lot of the hospice managers have lived through the death of a loved one. I mean, I personally started Stepping Stone Hospice because it was my daughter's dying wish that nobody else would suffer the way she did.
Yeah.
So we all honor, well, most of us honor, but we honor our patients anyway, every day.
Yeah, no, but exceptional. And I don't think also people understand the amount of training that your members, organizations go through. This is continuous training. So this is, in terms of world standards, the cream of the crop. And I think also internationally, the palliative care industry in South Africa is really recognized for its compassion, its innovation.
I'm so happy that you've raised the training component, because we're non-profits. People often think that it's substandard care.
No, not at all.
And it's not at all. So our nurses and doctors have their normal degrees that they get. They've done the ICU and emergency care stuff. And then they do an additional one-year course at UCT to qualify as a palliative care professional. So it's really, really, I'm delighted that you know.
Yeah, no, I think if you have been in that environment through a personal challenge, whether that's a family member, whatever, you really then get to see it. But I think if you just understand, or you just see hospice, I think sometimes what it does do publicly gives you a very different perception of what it is. And in actual fact, the hospices, for most people that don't know, it's not about end-of-life care. In actual fact, it's not.
So true.
It's so far more developed than that. It's around quality of life as opposed to end of life.
You should be a spokesperson for hospice
Maybe I should.
because you have insight that very few other people have. Palliative care starts at the time of diagnosis, while the patient is still receiving curative treatment. And they can come in and out of the program. Sometimes the patients go into remission, and we care for them during their treatment, pain, symptom, psychosocial support for the patient and the family. And then if they need us again, they just come back. You know, it's not a death sentence being a patient of hospice.
Yeah, and very important, as I mentioned at the beginning, and I want to reiterate this, that the type of care that hospice provides is for insured and uninsured.
Absolutely.
So it's for almost every demographic. And if you've been through a hospice, you'll realize, and this is the other thing that I think people don't realize sometimes, is that a hospice in a urban setting and a hospice in a peri-rural setting, same standards.
Yes.
Exact same standards.
Exactly same standards.
There might be a completely different social, economic setting, but the standards are exactly the same.
Exactly the same. You cannot operate as a hospice, and you cannot be a member of the Association of Palliative Care Centres if you don't comply with the international.
Because you wear two hats at the moment, right, Tertia? You are CEO of Stepping Stone, but you're also the acting CEO of the APCC.
Correct. Yeah.
That must be quite interesting.
It's amazing. I'm having lots of fun as the CEO,
Okay. Yeah.
but I miss my previous role, which was vice chair of the board of APCC, and I also then was chairperson of Gauteng region, and there's a lot of mentoring and stuff that you do that I'm removed from at the moment.
Because it's a very active role.
Yes.
And I mean, I think it's a very tough role because every time I've engaged with this conversation, and I think it was a couple of months ago, I think APCC was recognized globally, right?
Yes.
For its standards, for its
our
unit
fifth
standards.
editions.
Yeah, globally.
Yeah.
And I think it ranks incredibly high globally in terms of the unit standard for care. But the challenge is still, as the CEO, is to raise funds.
Yes.
Because if I'm saying that we're dealing with insured and uninsured people, we're dealing with individuals across different economic classes.
Yes.
So you're dealing from those that have to those that have very little, and because the unit standard is and the standard of service that you provide is globally recognized, it means that whether you come from an affluent area or an impoverished area, you are served exactly the same.
100%. If I look at the Northern Cape, we have a hospice there, Hearts of Compassion. They have,
I know it.
You know it?
Yeah.
1,100 patients, all rural, and their care is provided by 173 trained care workers, and they have volunteer palliative doctors and nurses that assist with the care of those patients. And our job as APCC is to engage with Department of Health and the organizations in that region to see if we can secure funding for the phenomenal work that is being done there. And it's the same goes for most of our hospices. They all need help with fundraising.
Tertia, give us if you don't mind, and I think it's helpful sometimes to understand the operational, and I don't want to use the word challenge because I think you're doing it every day, whether the challenge exists or not. But what does it take to take care of one person? What is the kind of cost, if you can, share with it, especially if that person is uninsured or you are paying for?
So the inpatient cost is very high because you always need a registered nurse on duty. You cannot just have caregivers. So it differs. You know, there's hospices where the registered nurses earn stipends, 1,800 Rand a month. That literally covers
I cannot imagine.
their fuel, if they're lucky. And then there are more affluent hospices. But what we are trying to get across now is with a growing number of professionals on adding their parents to the medical aids. And it's really re-educating the smaller hospices that are used to not even thinking that they've got a medical aid patient in their region to ask, have you got a medical aid? Do you have a card like this? Because if we could be at a situation where 40% of our patients were insured, we could care for the other 60% out of
from those 40.
From that 40%.
It would balance out eventually.
So it's a huge task. In my hospice, the cost of a patient's 1,100 rand a day in the inpatient unit.
Wow, that's mind-blowing.
So
a day.
So we pay rent. We pay. We have to have insurance. We pay electricity and utilities. We have to pay for our cars, our fuel, and absolutely amazing that our staff actually need salaries. So they have responsibility. So it's being a non-profit, in my opinion, is a tax status. It doesn't mean that you have to not have money. You need to generate income.
There's real operational costs. There's real operational costs, and that doesn't change for anybody. Yesterday, you started Hospice Week, and talk to me about Hospice Week. It runs until from the 4th, which is yesterday, until the 10th of May.
Yes. It's when we celebrate the work that we do, and we try and get the message out of what the definition of palliative care, that it's holistic care, and we honour the phenomenal work that the palliative care community do.
And in terms of what does that look like from an activation? So are hospices open for people to visit? I'm sure that there's information and access on the websites, all of that kind of stuff.
Lots of website, lots of Facebook, lots of Instagram. We're blessed to have radio interviews like with yourselves. We're even having a TV interview tomorrow. And it's really getting the word out. So the media world have supported us so wonderfully. It's getting the word out. A hospice being open for a visit, not easily, because patients in an inpatient unit, they're either very, very ill, or they could be at the last stages of life. And we guard their dignity and privacy with everything. The children's units are heartbreaking to visit, but we engage. We're going to shopping centres now, and we try and engage with the public.
The lady that I just remembered her name was Joy Rawudo.
Oh, okay.
Yeah.
All right.
So that at the time when I was engaging with hospice, it was with Joy. She's no longer there.
No,
She's moved on in leaps and bounds, doing lots of different stuff. But it was through that engagement that I was able to then visit the venues, have those conversations, do the walkthroughs.
I would love for you to walk through some of our hospices, the more affluent and the poorer hospices. And see that what is going on. You can only, and you have seen, but we welcome you back.
Yeah, because I do often believe And it's not just a hospice conversation. I mean, it's any conversation. If you look at any of these organizations, for example, you wouldn't get a sense of what Gift of the Giver's does unless you follow them, unless they take you on a day.
Yes.
Or any of the other organizations, whether it's the SPCA, also heart-wrenching stories. Like, so if you go with them on a day, your eyes open to the amazing people that sacrifice on a day-to-day basis to make the lives of others more comfortable. And in the case of hospice, which I think you've not there quite yet, but you're almost there, is to move hospice away from this idea that it's a place where people go to die.
Yeah.
Because it's not that.
It's not.
It might have been the thinking years ago, but that's definitely not in 2025.
During the AIDS pandemic.
Yes,
it was.
It was.
We cared for the dying, but it's no longer. AIDS is a chronic disease. It's not even something that kills you if you adhere it.
Yeah, you can manage a lifestyle around it.
So COVID, we cared for patients who'd been discharged from ICUs and were so confused and brain fogged and weak that they couldn't feed themselves. So it's we have a motto of we want people to live until they die. And
very powerful.
Yeah, and the most powerful muscle in the body is the brain.
Tertia, as we end of this conversation, Hospice Week is on. We're encouraging people to go and find out more about the organization.
Please.
We're asking them to, the more you know, the more conscious you are, the more informed you are about the work that the organization does. You can go on the platforms. You've got social media campaigns that's running at the moment. It's not walk-in centers. There's a lot of information available. But what is the big messaging? And I know as leadership, you guys have talked about outcomes of Hospice Week. What's the big takeaway for this Hospice Week this year in 2025 that you want ordinary South Africans, we've got a global audience, what do you want them to take away?
Do not fear your hospice. Embrace your hospice. We don't kill people. Disease kills people. We provide comfort care through the most difficult journeys that people will ever journey. But support us. We all, a lot of us have little charity shops.
Yeah, I wanted to quickly, before you wrap, the hospice charity shops. I mean,
aren't they wonderful?
They are, for people that don't know, but you've got to do your work. You'll find stuff like Gucci.
I know.
You find Gucci, Versace, Balenciaga. Yeah. This is not even a joke. You'll find some really amazing finds. I mean, I would actually say, if you are bored on a Saturday and you don't know what to do, go to a hospice charity shop. Go and spend 2 or 3 hours just combing through it. You'll stumble on amazing stuff.
Absolutely. I love charity shops. And it really pays.
It takes care of the operational stuff to a large degree.
To a large degree,
yeah.
It does.
So, and I think for you,
Gucci. I haven't ever found Gucci.
I've heard stories. Joy, when I walked through, I think I went to one of your charity shops. Was it in Brixton or was it?
Yeah, Hyde Park.
Yeah, I went to
Probably.
one. And Joy was telling me you'll be so surprised by the stuff you find, because people donate some of the stuff that they don't, and it's high-end quality products. Yeah. I mean, it's better than the other one. I won't say cash converters. I won't say it. Better than that. Yeah, you were saying.
Or pawn shop.
Oh, yeah. Oh, you're the pawn shops. Yeah.
Yeah, we, one of our hospices in KZN found a 5th edition book that they picked up and they auctioned and got 60,000 rand
Yeah.
for, I mean, what a treasure.
No, I literally encourage people, go to the hospice charity shops. If
Yeah.
you're into kind of thrifting and you're into all of that stuff, depending on where you go, maybe there's a lot to be said. Maybe the kind of technology can be juiced up a little bit. But if you're just looking for a fun Saturday morning and you've got a cup of coffee, go into a hospice charity shop. You will find something that will blow your mind.
Can I tell you a funny story
Yeah.
quickly? My late husband
Yes.
used to, I'd go into our charity shop and I'd say, I got one of these. I'll buy another one. And I'll get home. And he donated my first one and I just bought it back from the charity shop.
I think that's what husbands do, Tertia.
I know.
We're there to frustrate you in the most pleasant of ways.
Yeah.
No, but that's absolutely amazing. Where can people go, Tertia, if they want to find out a little bit more about hospice, the work, the charity stores? I know there's a store locator on your website as well.
Yes,
Yeah.
absolutely. apcc.org.za. That's the website. And thank you so much
Yeah, no,
for
this
a
is,
wonderful interview.
thank you, Tertia. That's a great conversation to be had. Go and check out hospice. Tertia Berger is the Interim CEO of APCC, which stands for the Association of Palliative Care Centres. She's also the CEO of Stepping Stone Hospice, so you can imagine her hands are full. Currently we are in the midst, yesterday it started, on the 4th to the 10th of May is Hospice Week. Go and find out more about the work of this organization. It serves the insured and uninsured South Africans with compassion and resilience.